Someone that came in with actually tricep problem that presented as elbow pain, and he was working with tanks, and he was banging big nails in the tracks of the tanks. Hello, my name is Simeon Nialasha, and for the trigger point of the week, this week we're going to be covering elbow pain. So what we're going to do is dive into the software. We can choose forearm wrist pain. Let's just change the background and let's look at the symptoms. So what we're going to do is actually we're going to turn the model around and we're just going to look at the map, and let's choose this area and explore this one. Exciting. Okay, good. So of course, elbow pain, very common, commonly seen in people with repetitive activities. Of course, people that are desk work, using the mouse, using the computer, also sports related, occupational related. I had one very interesting one recently of someone that came in with actually tricep problem that presented as elbow pain, and he was working with tanks, and he was banging big nails in the tracks of the tanks for hours and hours on end. Came in with elbow pain, had it treated by a number of people, but actually it was coming from trigger points in the triceps. So let's have a look. I mean, look. So these are the muscles which will cause a myofascial trigger point referred pain to the elbow. As we said before, just now, the tricep, supinator, the brachioradialis, supraspinatus as well. Interestingly, this part of the supraspinatus can refer down, and coneus, which is part of the tricep, and the extensor digitorum. So these guys are definitely worth looking at in terms of the culprits for elbow pain. But then again, there's a slight misnomer, because there's pain located around the elbow, and these are the ones to look for that. But there's also elbow pain on gripping, or elbow pain on extension of the wrist, or elbow pain with repetitive strain. And for that, it's definitely worth looking at the brevis. So what we're going to do now is just focus a little bit onto the brevis. So there are several wrist extensors, of course, and actually the brevis itself, as the name would suggest, is a small muscle, and it's not that easy to get a hold of. So you have to differentially diagnose it. It tends to present as pain in the back of the wrist. So someone will come in with dorsal wrist pain related to repetitive strain activities, to occupation, to office work. But actually on gripping, they will feel lateral epicondylalgia or tennis elbow, however you describe it. So in terms of the brevis, we have, in terms of the anatomy, we have, it's quite simple really. We have the brachioradialis, and the next muscle that comes down is the longus, extensor carpi radialis longus, and then the brevis. And the brevis is just about available here, just as there's a little area that pops out just between the longus and the extensor digitorum. So we can locate it. It does a little bit of slight ulnar deviation. If you go into the software, you'll see in terms of the functional anatomy, Dr. Bob Goen has got some beautiful overviews of the functional anatomy there, so I highly recommend that. So in terms of wrist pain, what we can do is we can just search, as we said, search the model. You can have a little look around, have a play with it, choose an area. And this is also useful, of course, with your patients, if they come in and they say, you know, I've got pain in this area, and then we can differentially diagnose here. So that's the trigger point of the week, elbow pain, also related to wrist pain. Thank you very much for watching. Please feel free to like us on Facebook and on YouTube. Every like that you give us improves our algorithm, our ratings, and we're trying really hard to give you great content. Thank you for taking your time to watch us, and we hope to see you again soon. Thank you.